Thank you for coming to the urology clinic at Penn Medicine to discuss your kidney cyst. Here at Penn Medicine, we're experts of all masses and growths on the kidneys and happy to walk you through this discussion. So kidney cysts are incredibly common and they refer to a fluid-filled structure on the kidney. In fact, 50% of 50-year-olds will have at least one cyst on their kidney, and those numbers go up as we get older, meaning the older you are, the more likely it is for you to have one of these cysts or fluid-filled structures on your kidney. That being said, we do see cysts on boys and girls, young women and young men as early as their teens and 20s. Now, very rarely, there's a condition called polycystic kidney disease, where the entire kidney is replaced by cysts. This is a really rare disease that often runs in families, so it's highly unlikely that you have polycystic kidney disease. But what your primary care doctor or referring physician is most worried about are solid renal masses. And solid masses in the kidney, as opposed to fluid-filled structures, are most often cancerous or malignant, and we will have a very different discussion if that's what your imaging shows. So cysts are often classified as something called the Bosniak classification system. You really don't need to know the details of that, but what you need to know is that a simple cyst is the most common cyst we see. And consider these like a water balloon, thin-walled, fluid-filled structure. As that cyst becomes more complex, the risk of malignancy or cancer increases. And complexity refers to either septations through a cyst, so that it may look like grapes instead of one solid water balloon, or it may have a solid component, either calcifications or almost like a mass growing inside that cyst. The more complex a cyst is, the more we are worried about you having a cancer. That being said, 100% of simple renal cysts are benign, and it's important to understand what these cysts are not. These are not cancer, so they're not going to spread from the kidney. They're not going to kill anyone. Very, very, very rarely do cysts cause pain. And in fact, most of the time, we're able to reassure our patients that this cyst is not causing discomfort they may be feeling in their back or in their abdomen, and they can go work up other causes of pain with their primary care docs. Renal cysts do not cause decreased renal function, although we do see slightly higher rates of cysts in people who have what we call chronic kidney disease or end-stage renal disease on dialysis. And very, very, very rarely do renal cysts require surgery. And even when we're dealing with cystic renal cancers, which on that Bosniak spectrum, which goes from 1 to 4, are your 3s and 4s, most of these cystic renal cancers are benign behaving, as opposed to solid kidney tumors, which can be more aggressive and have the ability to spread from the kidney. Therefore, for most kidney cysts, surgery is rarely required. We often talk about observation or watching these. This can be done with a primary care doc or a local physician, or we're always happy to see you here at Penn Urology. In rare circumstances, we may recommend aspiration or removal of the fluid from the cyst, although that's not a great choice because most of these cysts will recur because we're not treating the underlying mechanism. And in rare circumstances, we would recommend either removal of just the cyst, something called a decortication, or in some circumstances in patients with end-stage renal disease and risk of cancer who are considering a transplant, we might recommend removing the entire kidney or the mass. I hope that's helpful. We look forward to talking.